Hi everybody, I'm Dr. Isiorho, Corrective SW Health Center in Tigard, Oregon. I want to show you how I do my Unna boots. I've been seeing some techniques. I just want to make sure that it's easy enough or people can follow it well enough. And Unna boots, U-N-N-A, it's basically zinc impregnated gauze wrap. We use this when we see edema or erythema on the leg. Sometimes we use it for dermatitis. Sometimes you just use it as a cast for ankle sprains. I'm going to make cleats, and I also wanted to show something pretty cool and nifty that we've been using in our office. We've been using the bump, so we don't have to worry about fighting, and I'll show you what I mean by fighting. We do have a wound on this other leg, so ignore that. You probably may notice that from future videos. But basically what I always suggest and ask my staff has gotten really good at this, is we anchor. So the first lap around is basically an anchor. And you want to make sure there's no wrinkles, otherwise that can actually cause more irritation. So you want to go all nice and smooth. So the first time around is pretty much just once. You don't do anything fancy. Now here comes the fancy part. We start making pleats, or basically we start allowing swelling to occur naturally. And one thing about this is I'm never forcing the foot or the leg to go in a position, the wrap to go in a position that it doesn't want to. I am making sure that there's no wrinkles, again, directly against the skin, because we do not want to cause any new problems or issues. So like I said, these pleats allow swelling and this dressing to expand with the swelling. So after I get done with the pleats, I just go once more around. I don't go up too far, too high up. I don't want to press or impinge on the peroneal nerve. And then I put a pad for my compressive dressing, because we are going to use this for edema control as well too. I love this web roll type of dressing because it tears really easy. If it starts to lay down in the way I don't like it, we correct it. So we use this to give a little bit of a cushioning so we can add our final layer compression, and you can use any kind of compressive layer that your provider has recommended for you. So whether it be, ACE bandage or a compressive grip or an actual compression stocking, that's fine. Just make sure you're compliant, you don't go too tight. And this is that dressing, this is that bump I love right here. Because again, you see as I'm going round and round, my patient isn't having to lift her leg up. She's just basically able to rest it. And this is so, so wonderful. And I see so many times people are fighting to go around. And in my office, we try to keep it simple. Tries to keep it a big word. Is it feeling okay? Not too tight? And it's good to get feedback that may or may not be neuropathic. You always want to make sure it doesn't feel too tight. You always want to make sure that your Velcro strap ends in a comfortable position for the patient, so they're not standing on it, walking on it, or it's not going to be an area where it rubs. I usually use a 2 or 3 inch, the shorter dressing on the foot, and then the longer dressing on the leg. Always want to make sure, of course, you hold the foot 90 degrees. And again, this is not something I'm pulling tight. I'm literally just laying it down so it fits and conforms. And that's that. With this dressing, it usually comes off within a week or so. And that's that. Until next time, Dr. Isiorho, Corrective SW Health Center in Tigard, Oregon. Peace.